Most Westerners look at Eastern medicine and they see a very simplified version of the process, that they don't always understand that the whole patient is being treated. As a result, the complexity makes it challenging for them to accept and understand the process. One of the great unsolved mysteries of science is how humans respond to treatments. If we better understand the scientific basis that underlies the disease, and in particular, if we better understand how our treatments influence the healing process, we have a chance to make great strides forward in the treatment of pain and other human diseases. Most of my research focuses on plants. Plants, even though they don't have a central nervous system or a brain, seem to be able to detect and recognize when they're being eaten by different kinds of insects. Plants and animals have a lot in common in that regard that's largely underappreciated. So if we can understand how humans respond to a painful situation, if we then treat those patients, we can measure substances that they produce in response to treatment and learn more about the basis for how to make those treatments more effective. Our laboratory specializes in measuring hundreds to thousands of substances in the biological tissues or fluids. What you see before you here is the mass spectrometer, which is the workhorse instrument that we use for doing these measurements and for identifying the substances that are changing in levels after different treatments. So what we hope to do in our collaboration with Jiaseng in particular is to measure these substances during the course of treatment so that we can understand which substances are being influenced by the treatment and to guide the application of Eastern medical practices toward a scientific basis of healing and reduction of pain. The greater challenge, I think, is that there's an enormous demand worldwide. I mean, we have billions of people on the earth, and I don't know how many Dr. Shin can train in a short time to satisfy the global needs for top health care. But if we understand how his procedures work, then I think we hope at least that processes that are beneficial to patients will become more widespread, really across the world.